I'm Terry Hancherick, Chair of the Adult Issues Committee of the Delaware Developmental Disabilities Council. We know that about 50% of people with Down syndrome will get Alzheimer's as they age. Here, Dr. James Ellison of Christiana Care Health System shares information about Alzheimer's, what it is, and steps that individuals can take. For individual medical advice, please consult your medical professional.
So when we talk about Alzheimer's disease in older adults, we're talking about a condition that used to be called a dementia. Now we call it a major neurocognitive disorder. It refers to a condition in which there's a disturbance of memory and other cognitive functions that's sufficient to interfere with living independently. But we can also use the term Alzheimer's disease to refer to something different, and increasingly that's happening. Alzheimer's disease can refer to the pathology, the process of plaque and tangle accumulation that occurs for decades before there's a dementia that's clinically observable. Well, first let's talk about what is the risk of somebody with Down syndrome to develop Alzheimer's disease. And the risk is very high for a number of reasons. A person with Down syndrome is predisposed to develop Alzheimer's disease because they have 3 copies of the 21st chromosome. And on that chromosome is the gene that encodes for a protein called amyloid precursor protein. Under certain conditions, amyloid precursor protein is snipped and produces a toxic fragment of a protein called beta amyloid. And that beta amyloid can accumulate in the brain in the form of plaques, which cause an inflammatory process and cell destruction. Now, if you have an extra copy of that 21st chromosome, you accumulate more beta amyloid. In addition to that, there are other genes on the 21st chromosome that affect the risk for Alzheimer's disease through their effects on the immune system. A person in their 20s with Down syndrome may already be found to have evidence on neuroimaging of plaque and tangle accumulation in their brain. By age 35, plaques and tangles are present in the brains of almost everybody with Down syndrome. Usual onset of Alzheimer's disease in somebody with Down syndrome is in the 50s, and the average life expectancy now is 60. By the age of 60, it's estimated that more than half of people with Down syndrome have clinical evidence of the dementia called Alzheimer's disease. In older adults without Down syndrome, we usually spot the development of Alzheimer's disease first by noticing changes in memory function. Episodic memory, or recall of recent events, is very sensitive to the changes that are brought about by Alzheimer's disease. In a person with Down syndrome, however, we may see some different signs first. Some of the signs are behavioral or emotional rather than cognitive. So, for example, a person with Down syndrome may have been functioning at a certain level, living partially independently, working to some degree. If they start to develop Alzheimer's disease in their 30s or 40s, what we may see are changes in behavior that involve depression, emotional indifference, changes in communication, changes in self-care, increased incontinence, emotional lability with anger or irritability or agitation. These are some of the behavioral changes that could occur. We can also see increased obsessions or compulsions or anxiety. We can see withdrawal from usual activities or loss of interest in being with people, less interest in conversing and communication, less chattiness, less friendliness. And if a person sees those kinds of symptoms, we want to make sure that there is not a medical disorder that's accounting for that, or a change in environment that might be accounting for it. Alzheimer's disease may be the reason for these changes. If a caregiver of a person with Down syndrome suspects that they may be developing cognitive decline on top of their baseline developmental disability, there are a number of steps that they can take. First of all, examination in primary care will rule out medical conditions that might cause cognitive decline. This would involve looking for diseases like sleep apnea or diabetes. It would involve examining a person's medications and making sure that they're not on something which has side effects that are affecting their thinking or memory or sleep. In addition to this, a physical examination may be beneficial in determining the presence of medical disorders. I think that there's considerable reason for hope that we may be able to do more for people with Down syndrome at risk for Alzheimer's disease. The reason I think this is because, unlike the general population, we know in advance that people with Down syndrome are at a high risk to develop Alzheimer's disease, and we know this for many years before they develop the disorder. This gives us the option for treating even in utero, and some medications have been shown effective in mouse models of Down syndrome for reducing later cognitive decline. Now, in addition to this, there's a long period of time during which the brain is maturing, and there are medications now being tested in mouse models and hopefully soon in people that may help the brain mature more effectively. In addition, we now have excellent neuroimaging techniques that can detect the development of dementia in a person with Down syndrome at a very early stage. And knowing this in advance, we can modify the person's environment and reduce stressors and give them various kinds of medical and environmental supports that will help them. So for all these reasons, I think that we are looking at a future that is more hopeful.
We would like to thank all of those who participated in this project. For more information, visit decommunityconversations.com.